All right, so now we are looking at non-fatal drowning or near drowning. So what this is, the pathophysiology, is hypoxia from submersion. This affects the multiple organs in the body, specifically respiratory impairment, and they survive for at least 24 hours. So since they survive for at least 24 hours, that's why it's non-fatal, and that's why it's near drowning. So risk factors, lack of supervision. So like with pools and stuff, you're not watching your children. You weren't supervising them. They fell. They can't swim. Obviously, they can't swim. It's a risk factor for drowning. 1 to 4-year-olds. It is what it is. 1 to 4-year-olds is the age that this happens the most. Male adolescents. For some reason, it happens more often to males. So kids under 1 year old, these are ways how it can happen. They drown in bathtubs, buckets, and toilets. Kids 1 to 4 years old, it usually happens in swimming pools. And then kids 15 and up, it happens in like lakes, oceans, on boats. So all of this happens on boats, diving accidents, or if you're supposed to use floaties or a life jacket because you can't swim and you didn't use them, that's what happens. So signs and symptoms. Respiratory distress, altered level of consciousness, hypothermia, coughing and gagging right after, cyanosis, and comatose. How to treat and manage it. For respiratory support, you want to oxygenate them. You want to do rescue breathing, CPR. Check the ABCs. So airway, breathing, circulation. You want to re-warm them. For if they have hypothermia, you want to warm them up. And you want to monitor for complications. So you want to monitor for infection due to the aspiration of water. Or ARDS, acute respiratory distress syndrome. So you want to monitor for infection. You want family support. Educate them about the safety of water. So floaties, life jackets, supervising them, swim classes, CPR classes. You also want to monitor vitals and the neurostatus, especially O2. So that concludes for non-fatal drowning and near drowning. So here's some fun facts, things that you need to know that I went into a little bit more detail about for the neuro section. So intracranial pressure. To lower intracranial pressure, you can give osmotic diuretics like mannitol. Mannitol is an osmotic diuretic. If you looked at some of the things in pharmacology, think osmotic sounds like aquatic. Diuretic has to do with water. Mannitol, think of a manatee. Okay, so it's diuretic gets the water out, osmotic, aquatic. So this is what you're going to use for intracranial pressure. Seizure precautions. So if they have a thing for seizures, like a risk for seizures, these are the precautions you want to take. It's the same ones as you would for an adult. You want to pad the railing. You want to lower the bed to the lowest. You want suction and oxygen available. You want all 4 side rails up. You want to time the seizure, and you want to turn them to the side. Now there is the glaucoma scale, so the GCS. So these are the ways that you check to see the GCS. So it has 3 sections: the eye, the verbal, and the motor. So the eye opening has 4 parts. So 1 is if they don't open their eyes, 2 is if they open to pain, 3 is they open to speech, and 4 spontaneous opening. So the higher the number, the better they're doing. So verbal. 1, you score them a 1 if they don't have any verbal commands. Nothing. 2 is if they're moaning or they're incomprehensive. 3 is if their cries are not consolable or if they just don't make sense. 4 is if they're crying but consolably, you can console them, or if they're just a little confused. And 5 is if they're cooing, babbling, or they can talk good. Okay, motor response is 1 to 6. 1 is if they have no motor response. 2 is if they have extension to pain. 3 is if they have flexion to pain. 4 if they withdraw to pain. 5 if they can localize the pain. And 6 if they can obey commands. Again, the higher the number, the better they're doing. So the way to find the total GCS is you're going to add up E, V, and M. So if they can open their eyes to speech, and they can not talk, but they can obey commands. So we're going to do 3 plus 1 plus 6. That's 10. So 9 to 12, the moderate. So if it's between 13 to 15, their injury is mild. If it's between 9 to 12, it's moderate. And if it's lower than 8, it's severe, and they're probably in a coma. So that's going to be it for neuro.